Hello all and welcome to your session on mastication. This is Dr. O and we're going to start off with a discussion on osteology and how these parts relate to mastication. We'll talk specifically about the significant bony landmarks and openings that relate to the temporomandibular joint, mastication, and passages for key neurovasculature. I also want to note right up top that there are a lot of definitions or etymology sprinkled throughout the slides in this deck, and there will never be a test question trying to define one of these words, but my hope is that seeing how this word was named and what the shape really is representative of can help you remember the name and remember the structure. So I find etymology very interesting, and that's how I've added it in here for you, and I hope that it's helpful. So here we have the TMJ. So TMJ standing for temporomandibular joint. We really need to first find our two bones related, right? So here is that temporal bone. It's very irregular. And then below it, inferior, we see the mandible. Where those two come together is the TMJ. So let's talk about important features of the TMJ. First here we see the mandible starts with a body, more midline. Then we see angle, and at the angle is where then coming upwards we see a ramus or a branch. That ramus then branches into two processes. So we see these two distinct processes. The more posterior of them is the condylar process. And condylar or condyloid processes are often associated with joint articulation surfaces. So you see it's very rounded and fits really nicely into the temporal bone. This sits in the concavity of the temporal bone. So we can see that kind of shadowed here. And we also, from an inferior view now, can see the divot on the inferior portion of the temporal bone. That is the mandibular fossa. So this is where that condylar process sits. And just anterior and a little bit inferior to that is the articular tubercle, also on the temporal bone. And this kind of projects inferiorly here, and it's important in terms of the functioning of the joint. So we'll come back to that when we talk about dislocations and the movements of the TMJ. Now these videos I have embedded here just to show you kind of these structures and how they relate in 3D space rather than looking at just a couple views. So we'll start by turning this skull looking from the side, and we'll turn on the annotations. So right away, why don't you pause and try to identify these three structures that you can see outlined in purple. When you're ready, let's talk about them. So we can see the process here and that rounded edge of the mandible that makes up the TMJ. That's the condylar process. Then this concavity, or kind of the shadowed spot, is the mandibular fossa. And then anterior and a little inferior to that, we find the articular tubercle. Let's let the rest of this video play. You can see kind of how wide the mandibular fossa and the condylar process really are medial to lateral, and how that projects downward. Let's now move on to the bones that relate to the muscles of mastication. So these are all attachment points for these muscles, and I've actually grouped them by the muscle they're related to. So we're going to go through them one at a time, starting with the temporalis muscle. Now, to locate the temporalis muscle, put your hands on either side of your head and actually bite down. And as you do this, you're going to feel a muscle moving, and that is your temporalis muscle. Now we see the attachments of the temporalis muscle really well on a lateral skull. Specifically, the superior attachments are on the superior and inferior temporal lines. Now these are little ridges that are sometimes a lot more obvious than others that form from pulling of the muscle and its fascia on the bone in the area. So superiorly, we see the fascia that is superficial to the temporalis muscle will attach there, and inferiorly is the muscle itself. As we move more inferiorly, we can imagine that this entire space here is occupied by the temporalis muscle. And then as we head toward the mandible, we see another feature of the skull, and this is called the infratemporal crest. This is found inferior to this area called the temporal fossa. And we'll talk about that more in a future session. But for now, we see how that infratemporal crest can be an attachment point here on the way down to the mandible. The inferior attachments of temporalis are on the mandible. We see right here this anterior process of the mandible off of that ramus is called the coronoid process. So one of the attachments here is the coronoid process. And then if we follow that process down, there's a crest. And this crest is the temporal crest. So the muscle has its attachment mostly on this medial surface of the coronoid process and then down along that crest. The second muscle we want to talk about here is the masseter muscle. To locate the masseter muscle, put your hands on either side of the mandible and close your mouth and clench down. The muscle you feel moving is the masseter muscle. Superiorly, that masseter muscle has its attachment point on this feature right here, which is called the zygomatic arch. Now we think of this colloquially as the cheekbone, kind of extending from this region over and back. So this zygomatic arch is formed by two bones, the zygomatic and the temporal bones. The inferior attachment of the masseter muscle is along the angle and the ramus of the mandible. So we can imagine this entire space here, if the mandible were fully articulated, is full of that masseter muscle. The next set of muscles are found medial to the mandible. So the first two we talked about, the temporalis and the masseter, are found mostly lateral to the mandible. These next two, the pterygoid muscles, are found medial to the mandible. We're going to start with the medial pterygoid muscle, which is the most medial of these muscles. We find that it attaches superiorly here to the pterygoid plate found here. So this is the lateral pterygoid plate, and we see that the medial pterygoid muscle is attaching to the medial surface of that plate. Now, similarly, in that region, we find the posterior aspect of the maxilla here is called the maxillary tuberosity. There's a bit of a roughened projection on that area. And I'll note that this right here is the lateral pterygoid plate. So you can imagine on the other side of that outlined structure is where we would find the origin of the medial pterygoid muscle. Inferiorly, it mirrors the masseter on the angle in the ramus of the mandible. The last muscle here is the lateral pterygoid muscle, and it will have an attachment point superiorly on the part of the sphenoid bone that we can see from a lateral view, which is called the greater wing. We've seen the greater wing from in the cranial cavity, but you can also see aspects of it on the lateral side of the skull. Also then is on this lateral pterygoid plate, and we can see at this point, now we're talking about the lateral surface. So both muscles attach there, but the lateral pterygoid is now on the lateral surface. So the muscle will course from these superior attachments toward the area of the TMJ. The inferior head, which we'll get into more detail about the heads in a future video, will attach to this structure right here, which is called the pterygoid fovea. So this pit or shallow depression is found just anterior to the condylar process of the mandible. So this will serve as an attachment point here. And we'll also find that the lateral pterygoid muscle will attach to the joint itself. So let's take a look at the video here. We'll start by, as usual, turning to the lateral side, and we'll turn on annotations for the first muscle. So first off, we can see right away these lines running up and along. And these are the superior and inferior temporal lines. Then down here, we see the infratemporal crest. And then to find the distal attachment or the inferior attachment of temporalis, we're going to look a little bit more medial, but you can see the anterior process here, and then it kind of carries down into the temporal crest. So let's watch, and we'll see that actually that whole space here is occupied by the temporalis muscle. It's a pretty large muscle. There's the inferior attachment on the mandible, and then we get a view in where you can see that medial side here. All right, so next we're going to turn on the annotations for the next muscle. Here we see the masseter muscle. So running right along here is the zygomatic arch. Then running here would be our angle and the ramus of the mandible. Now that space laterally here is occupied by the masseter muscle. So now we'll move medially. Starting with medial pterygoid, we can see from a very kind of midline view, I'll pause it here, that is the surface, the medial surface of that lateral pterygoid plate. And then you also see that posterior aspect of the maxilla, the maxillary tuberosity. And then both of those kind of come together to attach to the angle and the ramus of the mandible, mirroring very nicely the way that masseter runs. So you can see that kind of paralleling each other there. Now in blue, we see the attachments for lateral pterygoid. Starting up here, we see the greater wing. Then deep to, you can imagine on the other side of the zygomatic bone here, we'll find the lateral pterygoid plate and the lateral surface of it. And then both of these come back here to that pterygoid fovea. So let's take a look kind of in a view where you can see it a little bit better. So when we're looking for lateral and medial pterygoid, think about their attachments as to which one will be more superior, which one will be more inferior. Great. So now let's move on to ligaments. So we'll talk about two major ligaments here regarding their attachment points. The first is the stylomandibular ligament, referring to that styloid process or the pointed instrument you may use on a smartphone or a tablet. Then again, sort of attaching down to the ramus and angle of the mandible, along with masseter and medial pterygoid muscles. The other is called the sphenomandibular ligament. Spheno referring to the sphenoid bone, and specifically to this spine. So the spine projects inferiorly here from the sphenoid bone. Then the ligament attaches there and to the lingula. Now when we look at the lingula, it's sort of right at the edge of where that mandibular foramen is, where we see inferior alveolar nerve pass into the mandible. So that lingula sticks kind of medial to it, and it's a bony landmark that you will hear a little bit more about other than its attachment point here. So let's start with the styloid process back here, and then the angle of the mandible, making up that stylomandibular ligament attachments. Then we see the sphenomandibular ligament is actually quite medial to it. So the lingula found there on the medial surface of the mandible, and then the spine, which we'll see when we kind of turn to an inferior view, a spine of the sphenoid bone kind of found posteriorly to that. Last, we'll move on to the passages. These are related regionally with the TMJ and kind of the muscles of mastication. It's also where some of the important structures pass from the skull to reach these structures. So first we'll start with the foramen ovale. Foramen meaning hole, and we can see a nice oval shape here. We remember it from that superior view as well, and that's where we see V3, or the mandibular nerve, or the third branch of trigeminal nerve, passing from the cranial cavity out into the infratemporal fossa. So in this space, we also see the lesser petrosal nerve related to the parotid gland innervation. More on that in a few. And then also an accessory meningeal artery can sometimes pass through. Just posterior to that, we see foramen spinosum. This is a very small hole, very round, and you might have wondered, why is it called foramen spinosum? But now let's take a look. Where is that sphenoid spine? Just posterior to it. So it's related to that sphenoid spine, which we talked about in the sphenomandibular ligament, and that is where it gets its name. This is the opening that the middle meningeal artery will pass through to reach the cranial cavity. The last here is called the petrotympanic fissure. Now this lies in the mandibular fossa, kind of posterior to it, but it is just a point. You can see it's almost like a crack between the two bones, the two parts of the temporal bone, and this is where we find chorda tympani. Now think about what you know about chorda tympani. What is that related to? So we know that's related to taste and also some parasympathetic innervation to salivary glands, the submandibular and sublingual glands. So again, more on that later. So let's take a look at how these are here. When we go from an inferior view first, this image doesn't necessarily represent the foramen spinosum very well, so I drew in a small circle where it would be. And you can see the ovale, the spinosum, and then that petrotympanic fissure there. And you can see the close relationship between the spine of the sphenoid and the foramen spinosum. Now if we look from a superior view, we'll remove some bones to see it a little bit better. And you won't be able to see the petrotympanic fissure from above. This is sort of just ghosting where it would be on the other side of the bone, because that chorda tympani will be in the petrous part of the temporal bone and then will exit through that petrotympanic fissure. So here, as a side note, we can see the three foramina for the parts of trigeminal, the superior orbital fissure, foramen rotundum, foramen ovale. Now remember, standing room only, SRO, but keep in mind that that spinosum is not part of that. That is then found a little lateral and posterior to foramen ovale. All right, so in all of these, I'm going to give you a question at the end, and I want you to take a second to choose all that apply and which bones form the zygomatic arch. So when you're ready, let's talk about what we can see here. So the zygomatic arch is this bone, or this bony feature, we can see running along here. So that bony feature is where two bones come together. You can see kind of the space between them here and here. So the first bone is projecting from anteriorly back, and that is really the cheekbone, right? So that is the zygomatic bone. And then the other is very related to what we've been talking about today, and that's the temporal bone. So the temporal bone back behind. So one thing, when you're thinking about the zygomatic arch, we're starting at the zygomatic bone, kind of this cheekbone, and then you can imagine if you've ever put on makeup and you've kind of taken your either contouring or blush from the cheek to pretty much just anterior to the ear, that is following the entirety of that zygomatic arch. So from the zygomatic bone to the temporal bone, all the way to that space which is the opening behind it. And that is the, right here, the external acoustic meatus, or that ear canal. Now that's everything for the osteology. Thank you so much for your time and attention. I look forward to seeing you in the next video, and if you have any questions at all, please feel free to reach out or ask questions on Piazza.